All right. It would help if I unmuted myself. So today is September 8th. The time is 9:06, and I am calling the Greater Boroughs Partnership for Health Advisory Board meeting to order. My name is Isabella. I'm the chair of the advisory board. And now just the quick script. This open meeting of the Greater Boroughs Partnership for Health Advisory Board is being conducted remotely, consistent with Chapter 2 of the Acts of 2025 relative to extending certain COVID-19 measures adopted during the state of emergency. This allows our group to meet entirely remotely so long as reasonable public access is afforded, so long the public can follow along with the deliberations of the meeting. The public is encouraged to follow along using the posted agenda, and all members can view the live stream or the recording on Northborough Media Connection, which is Northborough's new cable name, on YouTube via the link listed on the agenda. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting will not feature public comment. So members, when I call your name, just please respond in the affirmative. So Southborough,
Here.
Jen Westborough,
Here.
and Isabella Northborough here. So thank you all. Happy almost fall. I'm very excited. I know some people are not, but this is my favorite season. But with that, I will pass it to Michaela to share her slides.
Can you see that?
Yes, perfect.
Perfect. Okay. Let's go ahead and get started. This is the agenda that was sent out beforehand. So we'll start off with vaccine clinic updates. We'll then talk about a brief contact tracing grant update, move into shared services, what's been going on since July. And then at the end, we'll have a discussion about our communications work plan objective. We'll look at some of the FPHS results and kind of talk about what our next steps might look like. And then, as always, we'll finish with our meeting minutes and confirm the next meeting date. So jumping right into vaccine clinics. We've already scheduled out most of our fall flu vaccine clinics. So this month, starting this week, we have the senior center clinics in partnership with Wegmans. So Penny's been coordinating those. We have one at the Northborough Senior Center on the 10th, and then one at the Westborough Senior Center on the 16th. Both high dose and standard dose will be available there. And then in October, we have quite a few clinics. First up will be our drive-through clinic on the 4th at Algonquin. We'll talk a little bit more about that on the next slide. And then on the 9th of October, we have the Boylston Clinic. The 14th, we have the Northborough Clinic. And then we do have enough vaccines, and we're planning on doing at least 2 time slots in Westborough. We haven't gotten those dates just yet. So Jen, if I know you can't talk, but if you want to email me after this, or if you have dates in mind for that, that'd be great. We can do the 20th, the 23rd, or the 27th through the 31st on Mondays, Tuesdays, or Thursdays. And across all of those clinics, we have a total of 420 vaccines provided by Salmon to distribute amongst those different clinics, and then do additional home vaccines or things like that, depending on availability as we go.
Yep, and then Southborough buys their own vaccine. So Michaela and Penny will be assisting with their clinic. I forget the date, but
October 8th.
okay.
So beginning of October will be a busy time. So that's all we have, just kind of the overview. And then we'll talk more about the drive-through clinic. We already have a flyer ready with the registration that'll go out probably by the end of this week to start getting signups. We've allotted 250 vaccine time slots for the time that we'll be doing the drive-through clinic. So we have the flyer, and then we also have yard signs that we'll start putting up soon. And then Isabella, I don't know if you want to talk about any of the other logistics for the
Yeah,
drive-through clinic.
so this is for all four towns. So we'll be, once I have those yard signs, we'll be kind of distributing those and then obviously flyers, social media. I am coordinating with Northborough DPW and IT to make sure we have all of the proper supplies, hotspots, you name it. As for vaccinators, we already, four salmon VNA nurses, will be helping us. So Celeste, Heather, Karen, and Penny. And then we're looking for maybe one or two more. So if you know anyone who wants to help us out, if not, we'll reach out to MRC. Similarly, with the greeters and scribes, usually the National Honor Society students are excited to help us out. So once we get a little bit closer, I'll coordinate with Mary Ellen. But again, if you know any other volunteers that are non-medical, they're welcome to assist as well. I think that is pretty much it. So
I
200. Yep, go ahead, Jen.
sorry.
Sorry.
I do think that I might have someone that'd be able to help
Okay,
with the drive-through.
awesome.
That's a nurse.
That is a
Awesome.
nurse.
Yeah, that's on the fire department.
Oh, perfect.
So
Did you guys hire a new nurse?
no,
Oh,
they're a fireman nurse,
got it. Got
kind of
it.
like Jim.
Nice.
But I'll let you know for sure.
Okay.
Okay,
All right. Perfect. Thank you so much.
awesome. So that is
So,
clinics.
Michaela, maybe in the email after this meeting, you can send out the flyers as well.
Yeah.
Perfect.
Yeah, all the communication, which is conveniently, oh, sorry. The next slide. I'd already posted about the senior center flu clinics on the Instagram, and sent those out. So next up, I will send out our Instagram and social media posts as well as the flyer for websites for the drive-through clinic, and the other clinics that we will be hosting. So those will go out shortly. And if there's any other specific communications that you want for your town or information about vaccines, feel free to let me know. Um, but yes, this will be going out with the email, so everyone has it. And then speaking of kind of communications, this will be another summary available, but just kind of wanted to summarize at least at this point, and based on when I revised these slides Friday, this is the current recommendations. The good news is flu and RSV vaccines, for the most part, are status quo. So really anyone 6 months and up can receive the flu vaccine. And then for RSV, it's the same risk groups from last year. So infants, people who are pregnant around 32 to 36 weeks, and then older adults, 75 years and up, regardless of risk factors. They did expand it to include 50 to 74 with a risk factor for this year. And since these are not much has changed, standard insurance coverage and standard access should apply in terms of where people normally get vaccines. Um, Still kind of to be determined in some respects, are COVID vaccines. So in Massachusetts, this should be accessible, given the press release that came out last week about insurers having to cover vaccines, that DPH recommends. We're still waiting on that official list from DPH of what their vaccine schedule will be for Massachusetts. Um, but as of right now, the FDA labeled use for the COVID vaccine is, anyone 65 years and older, adults with a high risk condition, which is still the CDC's list of high risk conditions, which is pretty exhaustive. And then there are some vaccines available for children 6 months and older, again, with a high risk condition. Like I said, in Massachusetts, insurance coverage should now be, it should still be covered, and it can be given at pharmacies with the standing order. But we'll see what ACIP decides later in September, and then what DPH comes out with at the end of September.
Michaela,
Before I
can you
move,
remind me,
yeah,
the standing order, what age is that for
that I
pharmacists?
believe is 5 and
Three.
up.
3+ for COVID.
Okay.
Okay.
So that
And
anyone under that age would have to just go to their primary care or pediatrician?
Yeah.
yes, yeah. And the like additional guidance, so American Academy of Pediatrics does recommend across the board 6 months and up. So there is some professional guidance in that realm. But yeah, we'll see what happens the rest of the month. Before I move on, any other questions?
No questions. I don't know if you're making this available to the public or not, but I get a lot of questions every year if you can get RSV multiple times. I don't know if you just want to make it clear that you can only get it once.
Yeah, I can definitely add this. I was planning on taking this and making a flyer and again giving it to everyone if they want to post it. So yeah, I can add that clarification about the RSV vaccine.
And then I don't know if it would go in the flyer, but it is a little confusing how there's three different types of COVID, or not types, but three different, brands, and each one is a different age range.
Yeah,
But
that because I
that's
think
a
there's
little bit
only
different
one.
this year.
Yeah, I think Moderna's the only one that's for
Yeah,
children.
I'm looking at it now. Yeah, Moderna is 6 months and older, Pfizer is 5 years and older, and then Novavax is 12.
So you can add that. But kind of wanted to give a status update of where things stand for now.
And then just as far as like salmon VNA, we've never offered COVID, or in the last few years, we haven't offered salmon COVID vaccines through salmon. So it might be on a future slide, but a CVS or Walgreens recently reached out and they said they'd be willing to do kind of like Wegmans is doing, host a clinic and doing COVID vaccine. So if that's something you're interested in, we can Michaela and Penny can kind of try to coordinate that because Northborough may be interested.
Westboro as well.
Perfect. Michaela, I don't know if Wegmans is doing it because it might be easier. Oh, they're not. Okay, Taylor, never mind. So Walgreens or CVS, we'll have to.
It's still very up in the air, they said. And their availability is probably none at this point, honestly.
Right.
They had one day to offer me, and it was like I'll give it to you, but we may not do it.
Got it.
Yeah, it's been a lot of up in the air. So, but that's all I have for vaccines. And then I'll pass it to Isabella to give a contact tracing update.
Yes. So contact tracing, we have the money until the end of this fiscal year. And in the process, I've been emailing with Hillary Johnson at DPH, who manages the grant. And because of all of the changes at CDC, this grant really now needs to be focused on its kind of original purpose, which is surveillance and respiratory diseases. So we're a lot more confined in the ways we can spend it. So just wanted to give that update and allow for any ideas, conversation. One thing that they are allowed to, or we are allowed to use funds are on is COVID test kits. So if that is something people are interested, I know Northborough, we don't have any more. So that's one idea. Other ideas would be to kind of move the nursing or epi line item from PHE to contact tracing for just this year. So we have more flexibility in the spending in PHE. But those are just a couple ideas, but just wanted to update the group on allowable expenses for this grant.
And then I'm going to move into PHE, but want to leave space if there are any other questions about contact tracing before jumping into the PHE shared services.
I like the idea of moving the line item over to give us more flexibility.
Sorry, I was unmuted. Do we want to, I would have to ask both Hillary and our PHE grant manager, Jess, if that is an option. Do we want to take a vote on that at the next meeting or?
I'm fine with moving that forward. So I move to move our, what Isabella said.
Yeah,
Sorry.
let's do the epi line item because that's about, Michaela, right, like 40,000.
Mhm.
Um, and then we can make that work only if it is allowed and approved by both DPH.
Jen, I'll make the motion so that you don't have to say it.
Thank you.
I make a motion that we move the epi line item to the PHE, from PHE to contract tracing, right?
Mm-hmm.
If approved by DPH.
Second.
Okay, all those in favor, Southborough,
Yes.
Westborough,
Yes.
and Isabella, yes. Okay, so I will touch base with them, and then regardless of the exact line items, it'll probably be like around 40,000. So we'll have more flexibility in PHE, and then trying to spend down the contact tracing. All right. And then was there any interesting COVID test kits or not really?
Not really.
No, not really.
Okay. Sounds good.
Perfect. Okay. So now jumping into PHE, kind of what's been going on. Circling back to our favorite topic, the nursing software. Karina and the social worker from Hudson were gonna join us, but because we switched times, they were no longer available to provide input on my senior center and my Juna because they've used both. Um, I think kind of from what I've heard from them, my they're both good. Um, my Juna is definitely ideal for a larger patient load, and tracking a lot of patients, which they don't always have. Um, and then for my senior center, Penny has been using it while she's been filling in for Celeste at the senior center in Northborough. So I talked briefly with her, and she likes using my senior center. She says it's good for keeping notes, and being able to kind of keep track of where people are and look them up, um, and see what activities they've been to, and just kind of where they're at. So that's kind of that side of things. And then Isabel, I don't know if you have any more information in terms of cost or things like that that you wanted to talk about.
So these are the updated prices. They didn't really change from last year. The 5,500 used to be 6,000, but because we're in September, they prorated it. I think we've been talking about this for a long time. I think if our nurses are more comfortable with my senior center, I'm happy to go with that. And it's a little cheaper as well, because we don't know exactly what the grant is going to look like in the next couple of years.
I agree.
Okay.
Yeah, that works for me.
And then we didn't have this originally budgeted in PHE because we were going to plan to do contact tracing, but because this is not respiratory related, we will now have those funds from the last motion, and we haven't hired our part-time nurse to cover the costs. So again, we have gotten this approved by Jess, so we can do that. So Taylor, if you want to make a motion.
Would this affect our budget going forward if we did hire a nurse?
No, because next year, FY 27, we won't need to pay for relevant because the state is making their metric software. So that'll save us $30,000.
Okay. If it doesn't roll out, just theoretically, would
Yeah.
it?
Yes, we probably wouldn't be able to pay for the software.
Or we'd have to cut other line items like
Like training.
nursing supplies or training.
Okay. I just want to make sure we would prioritize staff over software though.
Yeah, I
Okay.
agree.
All right. Chelsea, did you have something to say?
You asked the exact thing I was gonna ask.
Okay.
Yeah, the state has made every indication that that is FY 27. They are
Yeah.
rolling that out.
I make a motion to start the process of getting the My Senior Center software for nursing.
Second.
Okay, all those in favor, Southborough,
Yes.
Westborough,
Yes.
Northborough, yes, perfect. So I will start that process. Our IT director had talked to them in length. So I think we should be all set, but I will keep everyone updated.
Yay. Okay.
Isabella, do you need,
sorry.
us to approve the actual expenditure though? Like,
If we want, yeah, that's fine. Like the amount.
yeah,
Taylor, do you want to revise your motion?
Sure. I make a motion to approve the My Senior Center nursing software for a total of $5,500 for the first year and then approximately $4,000 annually going forward.
Second.
Okay, perfect. Thank you so much, Taylor and Chelsea. All those in favor, Southborough,
Yes.
Westborough,
Yes.
and Northborough? Yes. Perfect.
Yay. Okay, so continuing on with nursing, our part-time public health nurse position has officially been posted, and I'll let Isabella actually give the update because it's exciting.
Yeah, so we posted it actually on Friday, and this morning we already had 2 applicants that looked promising. So very exciting. So we'll probably leave it open for like a week or so, and then we will start scheduling those interviews just to make sure we don't lose any good candidates. So I think last meeting we agreed that it would be Taylor as the nurse representative, me, and then it's usually Diane, our assistant town administrator.
Nice.
And then
Exciting.
it is posted on the Northborough website. It's posted on MHOA, and I did send it to MAPHN, and then local public health has a new website that I have submitted it to. If there's any other ideas or you want to post it on your town website, just let us know and we can send you the posting and the description.
Yeah, we'll post it on our town website if you can send it to me.
Me as well, please.
Perfect. Thank you guys for
Awesome.
doing that.
Exciting. More on nursing. What we've been working on since July. Right now, a lot of blood pressure clinics, home wellness visits, some education events and presentations, as well as Maven coverage. At this point in the season, it's typically mostly tick-borne and food-borne, some respiratory, and then as we saw with the flu clinics, September and October are going to be very busy. So we are continuing on with blood pressure clinics in Northborough, Boylston, and Westborough. We'll have the flu clinics. Penny is doing a basic first aid training in Westborough this week at the library. And then also doing a hands-only CPR training at Del Webb in Westborough. And then Heather will be hosting 2 CPR trainings in Northborough and 2 CPR trainings in Southborough, kind of upcoming. That's not captured here, so a lot going on. But this is kind of just an overview of nursing services for now.
And this actually reminded me, so anyone in the 4 towns, if you have any residents who are interested in home vaccines for flu shots, just let Penny know, and we can work that out. We only have standard dose through Sam and VNA, so just keep that in mind.
We should be able to, depending on how many people, we probably could accommodate higher dose also.
Okay.
Can we possibly have a flyer for that?
The home vaccines?
Yes.
Yes, that's a
Yeah.
great idea.
Thank you.
Absolutely. Okay. That's nursing services. And then as far as health inspections go, continuing to work with MHOA on youth compliance checks in Northborough and Boylston. And then starting next week, both Michael and Chris will be attending the Tier 3 housing training, which is exciting. We've all been waiting for that for a while. They put it on pause for a little bit last year. And then inspections from July through August, mostly routine inspections, with 11 in Boylston, 53 in Northborough, 17 in Southborough, and 71 in Westboro, mostly restaurants and retail establishments. And Michael's obviously continuing to do inspections as we go. Yeah, that's inspections. And then this was sent out before the meeting. So we have a FY25 annual report that was put together just to summarize kind of what we did last year, what our goals are for next year. And this is something I think that would be nice to circulate through our communities, but also want to get feedback on the content and kind of where it might be most appropriate to circulate these reports within our communities in terms of whether that be boards of health or other kind of community organizations. But wanted to open it up to feedback if people got a chance to look at it. I can also pull up a copy, which I don't know if that will show it. So in case you didn't get a chance to look at it, this is what it looks like. We talk about the Greater Boroughs, kind of how we were formed, what our mission is, who we are, so our regional staff, and then kind of like we see in our meetings, the nursing services, what we've provided throughout FY25, environmental health, so inspections, health communications, biweekly EPI updates with links to our food resource guide and maternal health guide. The events and trainings that we do, so our CPR trainings, our breastfeeding workshops that we did last year, as well as other trainings that our staff and municipal staff have attended. And then what our next year, or what we're currently in, our fiscal year 26 looks like.
I just want to say that I was very pleasantly surprised how well it was done. Well, not surprised, but I think it was done very well.
Oh,
I
awesome.
second that. I think, Michaela, it was a lot of work, and this is something I've always wanted for our group. So thank you very much. And I would love to have some printed copies for like Board of Health members, or really just to have when people ask us what Greater Boroughs is.
Agree. Thank you so much.
Totally agree.
Awesome.
So we'll plan to print. How many do you think each town would want?
Have you thought about it at all?
I think 50 for Westboro is fine. Because we like to keep them on a counter and people come in a lot, so that'd be perfect.
Okay,
Awesome.
all right. So we have that health communication line item. So we will print some and then we'll distribute those.
Awesome.
I just tried to open the link and I don't know if it's just me, but I cannot open it.
Is it a
The one
Canva?
in
Oh wait, maybe this will work. Hang on. Oh, I got it. Thanks. Sorry.
Got it. Okay. No worries. The email, I always struggle with Outlook and getting things to open. So yeah, and I'll send this out. That's kind of our next item, is talking about the annual notification is required by the grant, and this is just a letter that goes out to town administrators, chief financial officers, board of selectmen chair, and board of health chair. This just kind of is a standard letter that's sent out every year. So hopefully they've seen it before, but it's just about being a part of GBPH, and kind of outline some of the responsibilities about working with the lead municipality, and clarifying that funds are only for adding to services, not supplanting municipal funds. And we're kind of thinking it might be a good idea with this annual notification to also send out the annual report with the people that are on this email, to provide additional context of you're a part of this and kind of here's what we've been doing. So I want to get feedback on if that feels like an appropriate way to kind of circulate that as well as printed in the towns.
I like that idea. Can I just make a suggestion about the annual report?
Yeah,
You should
absolutely.
include the award that we got in it.
Yeah.
Right, right.
What award was that?
It's the
It was
Mass Municipal Association Innovation
Innovation.
Award.
Okay.
Perfect.
It's hanging up.
Yep, I think I've seen it.
Jen, sorry, were you going to say something? I know you were unmuted.
That was a good call, Taylor.
So Michaela, for this annual notification, is what you need emails for each of these individuals from each of the towns?
Yes,
Okay.
that would be ideal. And maybe the best way, if people can follow up, like respond to my follow-up email with a list of those contact information, or where to find it if it's on your website.
So you'll send us a follow-up email and then we'll reply to that with those people. Sounds good.
Yes, yeah.
And then Michaela, I think in that process, you obviously will CC the director, and then do you have to CC someone at Ola Rach as well?
Yes, so I will CC Jess, our
Okay.
program coordinator at DPH, just so she has confirmation that we actually sent it out.
Perfect.
So if people see that email. Awesome. So that's annual notification. Anything else before we move on? Okay. Perfect. So now we're doing pretty good on time. Now we'll have kind of a discussion about our communication objective for this year. So this is just kind of a reminder of what that objective is, which is raising community awareness of shared services. And within that, there's these 4 activities. And a lot of the focus is thinking about how to make the materials more accessible, making sure we're communicating with key audiences, and tailoring our communications to those audiences, and distributing materials strategically, which we've kind of already talked about with the annual report. That's a great start at doing a lot of these things. But kind of want to go back to the preliminary results from the FPHS, which is kind of part of the reason we have the communication objective this year of indicated that in a lot of our communities, we weren't able to meet the needs of communication, so having communication infrastructure. But one other thing is we do have capacity and expertise to be able to do those things. So to kind of jumpstart the conversation, want to try something new to get feedback. So we'll see how this goes. If you want to log on to menti.com, I have a few questions where we'll talk specifically about communications. So you can either use the QR code on the screen, or go to menti.com and put in this code. And we'll kind of talk about what this might look like in our communities. And hopefully, Jen, this will be a good way to participate without actually having to come off mute. I didn't play this, so hopefully that works. But I will pull this up and give people some time to hopefully log on. If you have issues, speak up and I can troubleshoot. Oh, awesome. Okay. So yeah, just start filling out your thoughts of what public health communication means to you. So accessible information throughout the community, relevant public health topics, accessible, timely, responsive, widespread dissemination of timely topics, multiple sources, multiple
So
formats. Oh, go ahead.
I'm on my phone, so it's not gonna work.
Oh, are you joining from your phone? That's fine.
Sorry.
Um, no, you're okay. If you have anything else, this is a small group, so feel free to speak up too if you have any specific additions to the question other than the answers that pop up. Seems like a theme obviously is timely information and using multiple forms of communication, which beautifully should go into the next question. What communication topics are most relevant to your community that feel like are important to communicate? Okay, so we have alerts, vaccines, press release, state level updates, seasonal topics, regulation change, current public health topics.
I can never spell mosquito right. I don't know if that's correct.
I always go back and forth whether it's ES or not. Yeah.
I
As
feel
far
like to add some like context, I feel like this
Yeah.
season has been a lot of communication. I feel like anytime there's an update to the arbovirus map, I'm like trying to adjust a press release and trying to get the information out as soon as possible. But I think it's always difficult because I typically do like town news, but not everyone gets town news. So just understanding where, when, and how to get that information out.
It also seems to be 11:45 on a Friday afternoon that this gets released as well. So
Yes, it's always right as or like 3:50 on
yeah,
a weekday.
yeah.
Um, yeah, as far as like alerts, is that kind of the same thing as thinking about press release and those state updates?
State updates, yeah.
State updates. Okay. Awesome. Yeah, I think that's the tough part is being timely, but also making sure you have information to actually communicate. And it always does come in right the last second. Okay, so I think flowing from that, Isabella, you touched on that this too of doing town news and thinking about where to get those pieces posted. So what are some of the current strategies or methods of communication in your town specifically in terms of getting information out?
Westboro is town website and Facebook.
Town website and Facebook. And is that um, like can each department post on their own, or is there like a communications central person for town?
We do both.
Okay. Okay. Lots of social media, town websites for sure, flyers, email. Does anyone have a list serve for their town? An email list serve?
I have one for vaccines.
Okay.
So I just access the color and then email all the people who got the vaccine the year before and say, sign up for the clinic again.
Friendly reminder. Monthly newsletters. X. Which town department has a X? Is that Southborough?
Yeah, not our department, but the town does. That's their form of social media.
Nice.
That's the only one they have.
Okay. Cool. Okay, so a lot of online communications, some printed communications. So kind of want to get a feel too for um, what barriers there are, either in those forms of communication or in terms of what kind of keeps towns from being able to get out timely information, not being able to reach everyone. Sure. Yeah.
Right, Westboro is the same.
Yeah. Access to the internet, yeah. Yeah, I think that's not uncommon. It's tough to reach everyone. Information overload for sure. Yeah. Yeah, I think navigating how to get it posted to places that other people can see and who to get in contact with. Yeah, I think this is just wanted to kind of have like a picture of what this looks like. And I think a lot of us are in similar places in the different towns in terms of communication, and being able to get that out on time. So I think this went pretty well. I appreciate everyone participating. And this flows into kind of the next part of our discussion about so in the FPHS, we also listed partners. So thinking about, one of the pieces that can be challenging or barriers, figuring out who to contact when, and how to get the information to the right audience. So these were the partners listed from the FPHS as kind of a not comprehensive list, but this is the list that came out of that report. And wanted to talk about, is this a representative list of who our key partners in communicating out information, and how involved some of them are, and how maybe we could add to this list or take some off that aren't necessarily as active. But this is more just an open discussion about who our partners can be in communicating.
I would definitely say the town administrator's office is one that's missing from here that we utilize a lot.
Mm-hmm. An administrator.
I would say going off that, to post anything on Northborough's like town news, we go through the town clerk.
Clerk.
And so we go through the town administrator's office.
What about schools?
Yeah.
Yeah, I think the schools is a big one.
I don't utilize youth and family services to disseminate data. I don't know if anyone else does or not, but well, you guys would because you're one department.
I don't either.
We also don't usually utilize community advocate that often.
I think I did a couple times, or maybe once this year when the arborvirus was moderate. I think I did send them a message. I think the library is a big one, that we usually post flyers, and sometimes like we use for like the CPR classes, we use their calendar registration,
Mm-hmm.
and then sometimes their listserv. And then rec as well. We've
Rec,
used their
yeah.
listserv.
Awesome.
We also use their listserv.
Yeah, those are a lot of departments. Police and fire, that's one that's listed.
We use them to send data out or send information out a lot on social media.
Awesome. And then animal control. Anybody else?
I feel like we would get information from them.
Yeah.
So I mean, I guess it kind of goes both ways, but I guess they would communicate to maybe animal owners during their inspections.
Yeah.
I don't know. I guess I could see somehow that they would be communicating some of the risk or, current information. Thinking about like specifically arborvirus.
Yeah. Yeah,
I
and
would
this
say,
is
oh,
two
go ahead.
ways. Oh no, I was just gonna say this is a two-way communication. So like DPH obviously communicates to us, then we send that
Right.
out. So
We don't
both
really
ways.
use town IT to engage residents at all, just because we have other avenues, but I could see why it's on the list.
Yeah. feel like kind of that background role, at least with like websites and
Right.
that kind of stuff.
I would say one, at least in Northborough, because they're really trying to do more like videos, is the Northborough Media Connection, so the cable department. We've done a few videos with them.
Yeah, I think that's kind of my next question is what would an ideal list look like of who we reach out to kind of on a regular basis and maybe include in when we do have updates or public health communications. We've already listed a lot, and that might be our ideal list. But what would that look like?
Like when Greater Boroughs reaches out, you mean?
Yeah, I think in this context specifically.
I mean, I like for me, I would still say like go through me and then I would just have to decide who the appropriate person was, but
Mhm.
I agree.
Yeah.
We send things to a general IT web mail address, and then they will post it for us. So it usually for other departments, it always just goes through whoever I choose.
And then I think, honestly, one that is, I think, an oversight, but just boards of health. I think those meetings are
yeah,
helpful to get information out as well.
for sure.
Yeah.
No, I think that makes sense to kind of keep the central list in terms of GBPH, but it's also helpful to think about who that might be going to after the fact, when making communications. So this was super helpful in thinking about our communication. So that is all I have before we conclude. Is there anything else in terms of communications or thinking about how to kind of keep that infrastructure, build that infrastructure for our group before we move on? Okay. I appreciate it. I feel like this is helpful for me at least. So thank you all for participating. And now we will move on to meeting minutes and future meeting dates. Oh, right before that, upcoming trainings. There's a lot going on in the next several months. There is a local public health webinar tomorrow that should have some more vaccine updates and SAFE 2.0 reporting. The SAFE 2.0 reporting is part of our work plan. So if you want to get more information about what that might look like, I will be going to that meeting, but feel free to join. And then the Yankee conference is later this week. So can't wait to hear how that goes for everyone. And then several MHOA trainings and webinars. And then in November, we have the MHOA conference. So all these links will be sent out for registration if anybody wants to attend these trainings.
And Michaela is doing a presentation at MHOA. Do you want to tell us about it?
Sure. I am doing a presentation. I'm doing one poster presentation before the conference starts about how to integrate EPIs into local public health departments. That will be with another EPI from Plymouth. And then I'm presenting on Thursday a presentation, I don't like math, about using data in local public health and hoping to make people less afraid of data and using it in local public health. So if you're there, would be happy to see you.
And then, as always, if you register for any of these conferences or meetings, just let us know and we can pay those invoices.
Yes. And then last couple of things, approval of meeting minutes. So these went out. If there's any revisions or updates, let me know.
Nope. I make a motion to approve the advisory board's meeting minutes from July 10th, 2025.
Second.
Okay, all those in favor, Southborough,
Yes.
Westboro,
Yes.
Northborough, yes. Perfect. Those are approved. We'll get them to town clerk and they'll be posted on our website.
Perfect. And then next meeting dates. So I think, I don't know if we had confirmed November 13th in our last meeting, but that would be roughly when our typical cadence would be. We can stick with the 10 a.m. time if people are liking the kind of earlier in the day. But does the 13th work in November for everyone?
Sorry, what time is that one? Oh, it's at 10.
It's at 10 a.m., yeah.
November, wait, what? Oh, sorry. I'm looking at the last year for some reason.
I think
It's-
that's fine for me.
I have it in my calendar already.
Yes, it works for me as well.
Perfect. Okay, so keep that date. And then the next date would be January 8th at 10 a.m. if we keep it the bi-monthly.
Yeah, that's fine.
Right. Jen, does the 8th work for you too? In January?
Yes, it does.
Okay, perfect. So we will confirm that. Awesome. And that's it.
Perfect. Well, thank you all very much. I make a motion to adjourn the Greater Boroughs Partnership for Health Advisory Board meeting at 9:58.
Second.
Amazing. All those in favor, Southborough?
Yeah.
Westboro?
Yes.
Northborough, aye. Thank you all so much, Jen. I hope you feel better, and we will see you in a couple months or at the clinics.
Thank you, everyone. Bye.
Thank
Bye.
you.
Have a good week.